I'm Dina Nasser. I'm the health advisor at Augusta Victoria Hospital. I was the lead for the health mission that was supported and coordinated by Augusta Victoria Hospital to go to Gaza in response to the injured and the injuries to deal with were the people that were part of the demonstrations for the March of Return demonstrations in Gaza. We arrived on the 16th and we were immediately taken to the makeshift emergency rooms or ICUs, critical care units that were opened up to deal with a number of injured. It was overwhelming. I mean, it's almost undescribable, the shock of seeing so many young people, mostly conscious actually, and with severe injuries to both limbs. So you could see external fixations on limbs, you could see dressings, major dressings, but with the wounds seeping through, because all these injured cases happened on Monday and they were actually not touched yet till Wednesday. So not only was it visual, also the smell because of the space and the crowdedness, as well as the energy in the area. The staff were also very tired. There was one nurse in a room tending for five patients, and in my assessment, each patient needed at least two nurses for 1 hour to deal with the wounds, which was the case the following day. So it was overwhelming. The next day, I mean, having done that the first day, having just simply assessed the situation, we realized there's a major need for more nurses. Our first mission included a vascular surgeon, orthopedic, ICU, and our infectious disease specialist, because we knew there'd be lots of injuries to deal with. And we realized we are in need of nurses. So immediately we looked at each other and said, nurses, help. And Augusta Victoria dispatched a second mission the next day, including 6 nurses, ICU nurses, and 1 OR nurse, which was excellent, because immediately they addressed the wounds and they helped their colleagues because the staff there was overwhelmed and exhausted. Actually, the ICU was 12 patients, but they had already used also, the Shifa Hospital has already transformed the cardiac ICU in an ICU for the injured, the outpatient area for 2 makeshift ICUs. So all in all, there were like 25 young people in the critical care. Of these, there were around 5 who were intubated as in unconscious. And what was sad is that actually, I don't know, sometimes I wonder whether it was sad or whether they were relieved of the trauma and the pain, that there were 2 who had neck injuries, so they were already paralyzed from the neck down. One was hardly could move a hand. They said he was paraplegic, which means you can move both limbs, but hardly. 2 were already brain dead. I mean, and so mostly they were injured people who were awake and looking at us and looking very sick. And the rest who were really unconscious were of very poor prognosis. So the kind of injuries is that they were either to your neck and chest and that's it, you were gone. They were dead. You wouldn't see, we could not see the kind of injuries we saw when we went with Augusta Victoria in 2014 to deal with the injured from the onslaught on the civilians, because then you would see different wounds, you would see some abdominal wounds, but this were actually to the lower limbs, severe injuries to lower limbs that have torn blood vessels, bones shattered to pieces, and skin. Or the severe injuries that were unconscious if they haven't died. I was just reviewing the ICRC, the Red Cross manual on war trauma injuries before we left. I thought just to sort of see whether there's different approaches. And I tell you, what I saw was exactly like pictures of the ICRC booklet on war traumas, and I had a feeling that ICRC's new edition would be the war traumas we just saw in Gaza, because these were war traumas from like Kosovo and Lebanon, but now I'm sure they're going to have enough images unfortunately, for their new edition, because it's really, it's difficult to describe.